In this video, we are going to be going over whether or not LPNs are truly glorified CNAs. Stay tuned. What's up, you guys, and welcome back to my channel. For those of you who are already subscribed, for those of you guys who are new, welcome to the family. My name is Kiara Selena, and this is my channel, Nursing with Ki, where I make a whole bunch of nursing related videos, sharing tips and tricks that I've learned along my journey to help you guys have the smoothest nursing journey. So are LPNs truly glorified CNAs? I see people commenting on my channel all the time talking about how LPNs wish they were RNs and how LPNs can't do anything that RNs can do and how LPNs are really just glorified CNAs. And although one of those statements may be true because a lot of people who are LPNs are aspiring to become RNs one day or who are working to become RNs one day, there are a lot of similarities between the scope of practice of an LPN and an RN. Not saying that they're completely the same because they are not, but in terms of tasks, in terms of skills, the things that LPNs can do is very similar to what RNs can do. And that is what we're going to be evaluating here today. I'm going to divide this video into two parts. In the first part, we are going to be going over what the scope of practice of a CNA is and what the scope of practice of an LPN is. And we are going to compare what they can do and what they can't do. So we're going to go over what a CNA does that an LPN can do, or what an LPN does that a CNA can do. And then we're going to go over what LPNs do that CNAs cannot do. And we're going to do the same thing in part 2 for LPN and RNs so that people can really understand what the role of a licensed practical nurse is in the healthcare system, because I don't know, from what it looks like, people really don't know. So without further ado, let's get into this video. So when you're looking at what the scope of practice of a CNA is, and I have worked as a CNA for a very long time. I worked as a CNA while I was in nursing school, so I really know what the job consists of. And CNAs really are responsible for a person's activity of daily living. That is what they are there to help with. That is really what their scope of practice is. They're really just there to help with a person's ADLs. However, when you look at what the responsibility of an LPN is, it is very, very different. Now, I have this article. You guys are going to see me looking down. I have this article. I showed you guys an article in in another video, but this is an article that was written by the Board of Nurses where I live, and this is the professional activities of a licensed practical nurse. And here, under the Article of 37P of the Professional Code where I live, LPNs participate in the assessment of a person's state of health. In carrying out the care plan, they provide nursing and medical care and treatment to maintain or restore health, prevent illness, and they provide palliative care. So that is the difference between the scope of practice of both. Now let's go over the tasks, because I guess this is what you guys want to know. And for those of you who don't really understand what an LPN is, this is really, really important information for you. So let's go over the specific tasks of a CNA, right? So taking care of the activities of daily living, assisting nurses, LPN or RN, with care of residents, which is washing, clothing, things like that. Transporting patients to appointments if there's no transport, if there's no people specifically assigned for transport in the facility that you work for. Taking vital signs, and this is not everywhere because CNAs where I live do not take vital signs. However, in most places, CNAs do take vital signs, so I did include that. Cleaning rooms and changing linen. Now, this is not something that CNAs do every day. Usually, CNAs only change linen if it's absolutely necessary or if it's a person's shower day. Recording input and output, so taking record of what the person is putting into their mouths. If a person has a catheter, they will usually at the end of the shift look at the bag, see how much urine is in it, record that, and empty the catheter, the bag. And also helping with feeding, right? So these are the main responsibilities of a CNA. That also comes with shaving, grooming. All of those things come with the second point that I mentioned, which was assisting the nurses with care of the resident, right? So that is the main responsibility of CNAs. So now let's go over what LPNs are able to do. Now this is divided into two sections. I don't know if it's the same thing everywhere, but where I live, we have 10 reserved activities and I think 2 authorized activities. Now the difference between the two, LPNs are allowed to do all of these except that for the reserved activities, the 10 reserved activities, these are things that LPNs are allowed to do on their own without anybody's permission. They come in, they see that it was prescribed, they can do it. The authorized activities are usually things that are a little bit trickier, and LPNs are allowed to do it as long as they get permission from an RN, because sometimes RNs want to rather do it themselves. But if they get the okay from an RN or a doctor to do it, they are able to do it. They are trained, they are shown this in school. So let's go over the reserved activities of an LPN. The first one is applying invasive measures for the maintenance of therapeutic equipment, right? So in connection with this activity, LPNs may take any specimen, which is covered by another provision. This includes taking samples of blood by capillary puncture, urine, stool, anal secretions, and expectorations. Secretions from the conjunctiva, vagina, throat, ears, and nose, and wound secretions. So that's for point A. B, taking specimens according to a prescription. So I just spoke about all the specimens that we're allowed to take. Providing care and treatment for wounds and alterations of the skin and teguments according to a prescription. So packing, any type of dressing care, we are allowed to do it. Vac, packing, all of that stuff. Observe the state of consciousness of a person and monitor neurological signs, right? LPNs typically perform this activity, which consists of observing the patient's sign, parameters, and reactions. Monitoring neurological signs includes 4 types of tests: spoken word stimuli, pain stimuli, pupil reflex, and muscle function. The next thing is mixing substances to complete the preparation of a medication according to a prescription, right? So this says that LPNs may mix substances as required for the preparation of medications, including insulin and vaccines, and any other type of substance they are legally authorized to administer. Consequently, LPNs may not prepare medications that they are not legally authorized to administer, specifically via intravenous route. This means that LPNs are allowed to administer any type of medication except for IV medication. We can give IV solutions, right? Or hydration, but not medication. And this doesn't even apply to everywhere because only one province in Canada does not or forbids LPNs to give IV meds. But in the other provinces where there are no ADN nurses and there are only BSN nurses, LPNs are actually administering IV medication. So this really depends on where you live. The next thing is participating in vaccination operations under the Public Act, which, that's self-explanatory. We are allowed to give vaccinations. We have introduced an instrument according to a prescription into a peripheral vein in order to take a specimen, provided a training certificate has been issued to the member of the order pursuant to a regulation under paragraph 0 of section 4, right? So that's also pretty self-explanatory. Let me see if there's a specific explanation for that. Let's see. It doesn't really say anything. Like I said, it's pretty self-explanatory. And then you have the authorized activities. So the first one is maintenance of tracheostomy care connected to a ventilator, right? LPNs may provide maintenance and care of tracheostomy connected to a ventilator when the parameters of the ventilator are regulated. 2, they may open a device incorporated into the ventilation circuit in order to administer a metered dose inhaler. 3, they may ventilate using a manual self-inflating resuscitator when connected to an oxygen source or not. 4, they may reinstall the tracheal cannula in case of decannulation in emergency situations and in the absence of an authorized professional available to perform immediate intervention, such as an RN, right? So this is what LPNs are able to do when it comes to tracheostomy care. Lastly, we have assistance in the administration of intravenous therapy. LPNs may perform the following professional activities. They may install a short peripheral intravenous catheter measuring less than 7.5 centimeters. Administer an intravenous solution without additives using a short peripheral intravenous catheter measuring less than 7.5 centimeters. And they may install and irrigate a short intermittent injection intravenous catheter measuring less than 7.5 centimeters with an isotonic solution. So these are the things that LPNs are allowed to do. And like I said in the beginning, there are 10 reserved activities. Before there were 9, I mentioned 9. There was a 10th one that was added, and LPNs are allowed to apply, remove, and care for any casting. So if you're working in ortho, and somebody has a cast, you're able to, or somebody needs a cast, you're able to apply it, care for it, remove it if you have the proper training. So now, the juicy part. Let's compare what CNAs are able to do. Like, let's compare the two, right? We're gonna look at what LPNs are able to do, what CNAs are able to do, and we're going to really determine whether or not it is true that CNAs are, or LPNs, sorry, are glorified CNAs. So when you look at the scope of practice of a CNA, LPNs are allowed to do every single thing that CNAs are able to do. LPNs can do everything in the scope of practice of a CNA. But can a CNA do any of the things that is in the scope of practice of a CNA? And the answer is no. Absolutely not. The only thing that LPNs do that CNAs may be able to do is monitoring CBGMs or taking AccuChecks, because some places consider an AccuCheck a vital sign. So CNAs may be able to do that depending on where they live, and they are able to record every other vital sign, right? So when it comes to actual nursing skills, right? Real nursing skill, not basic care nursing skills, real nursing skills. The only thing that LPNs do that CNAs are allowed to do is AccuCheck, which still falls in the category of vital signs, which really means that CNAs are the only thing that LPNs do that CNAs are allowed to do is take vital signs. Nothing else. CNAs cannot take blood samples, they cannot take stool samples, they cannot take any samples, whether it's vaginal, expectoration, none of that. LPNs are not allowed to really observe LOC, so level of consciousness, right? Obviously, if there's no nurse around and somebody is unconscious, they're gonna have to use some common sense, but it's not really in their scope of practice. They're not allowed to administer any type of medication. Now, there was a new law that came out where I live that allows for CNAs to give some medications, because some private facilities do not want to hire nurses or do not want to pay for nurses to be there 24/7, and somebody needs to give somebody those meds. So CNAs are doing it, and that law or Bill 90 is allowing them to do it, but usually they are not allowed to do it. They are not allowed to give vaccinations. They are not allowed to introduce an instrument finger or anything into someone's body. And they are not allowed to do IV care, tracheostomy care, none of that. So are LPNs really glorified CNAs? Absolutely not. Because once again, LPNs can do everything that CNAs can do, but out of the 13 things I just mentioned, the only thing that CNAs are able to do that LPNs are able to do is take vital signs. So if you are going to LPN school and somebody is discouraging you, or somebody is making you scared, or making you think that you are not going to learn real nursing skills if you go to LPN school, that is absolutely false. You are a true nurse and you are not a glorified CNA. Okay, so that is the end of part 1 of the video. If you're interested in seeing me compare LPNs to RNs, which is the juicy part, that's what everybody wants to know, make sure you look out for part 2. I'm gonna leave a link somewhere up here, as well as in the description and in the end card. Make sure you go check out that video, because that is going to be juicy. I hope you like this video. Don't forget to like, comment, subscribe, share, all of that good stuff, and I really hope to see you in part 2. Bye.